Out through the nose again. Better.
What just the Oh my God, that felt so good.
Good.
Can I take you home?
No.
I just like want to lay here in like happiness for a second.
Do it.
We were on vacation. I was going upstairs. It was so painful, but I was so scared to tell anybody that I was in that much pain. I literally thought I was dying. My legs feel like there's claws in them, and like it's just bringing me down.
Rolling.
Oh,
Ew, wow.
my goodness. I'm more confident now. I've never popped that before. Oh, that's like how I want to crack my neck.
But it doesn't.
No. I haven't felt this way in a long time. Wow, that was awesome.
What did you expect it to feel like? Were you scared?
Like I said, I'm so excited to not be in pain that I'm like, I'll do anything. Let's do more. Well, I just been in a lot of pain.
Okay. Yeah,
because I got in a car accident 2 years ago, and then I fell in February and broke my wrist and popped something in my back.
Brutal. Okay.
So it's been
a rough couple years.
And I have fibromyalgia.
Okay.
So it's just like.
Yeah. When were you diagnosed with fibromyalgia?
3 years ago.
Okay. So were you having pain before the car accident?
Yes.
Okay.
But
was there something happened before?
No, it was just the fibromyalgia that really hurt. Yeah, I had a big flare up.
Okay. So when you have the flare-ups, where do you normally feel the pain?
In my back and my legs.
Okay. Lower back?
Yeah, right there.
Okay. So when you got into the car accident, what happened in the car accident? Somebody hit you from behind? Did you hit someone?
I hit someone.
Okay. That's okay. That's okay.
And I went into the embankment, and the airbag came and jerked my neck.
So after the accident, it was the neck that hurt the most, or what hurt?
Yeah. It was my whole back.
Your whole back.
To be honest, yeah.
So you're just like walking around feeling like a mess.
Yes.
Right now. All right. So do you get headaches and migraines?
I do.
How often are you getting headaches and migraines?
Every day.
Every day. Wow.
Yeah.
For how long now?
It's been 3 years.
Okay. So right around when you were diagnosed with fibromyalgia too? Okay. Neck pain?
I always crack my neck. Okay. To be honest with you.
Okay, we're gonna try to stop that. There's gonna be things that you can do at home that are gonna be better, right?
Okay.
But the thing is, when you crack your own neck, you're gonna do more harm. And the reason why is because you do it. Like, are you just going like this and it cracks, or are you like trying to?
No, I just go and it cracks.
Okay. If you just do this and you do this and it pops,
I'm not trying to like break my neck.
Yeah, as long as because I'll see people and like.
No.
Yeah, just don't do that. All right. Mid back pain, upper back pain.
Both.
Both. Okay. And lower back pain.
Yes.
Yes. Sciatica.
What's sciatica?
Sciatica is when the nerves are running down your legs.
Yes.
Okay. Any numbness and tingling in your fingers?
Yes.
All right, you got everything. So you got fibromyalgia 3 years. That's when you were officially diagnosed.
Correct.
Right. When did you start feeling something was not quite right in your body?
Probably like 7 months prior to my flare up.
Okay, and that was like almost
4.
Almost 4. Okay. Can you describe the flare up?
Well, we were on vacation, and I was going upstairs, trying to walk upstairs, and it was so painful, but I was so scared to tell anybody that I was in that much pain. I literally thought I was dying.
And you were in pain here, or where?
My legs feel like there's claws in them, and like it's just bringing me down.
Gotcha.
Yeah.
Okay. How was your pregnancy? I know you have a daughter. Was it hard?
Well, my pregnancy was great.
Okay.
This was before I got diagnosed.
Oh, no, I know. That's what, so I'm just trying to see what may have led up to some flare-ups, right? Okay. Because fibromyalgia, there's so many different things as to why a doctor might diagnose somebody with fibromyalgia. I've seen people come in and they're like, we don't know, so we just gave you a blanket diagnosis.
My grandma had fibromyalgia.
Okay, yeah, so that's what we're trying to see. But at the root cause of it, like, we just want to see if there's anything in the spine that we can help with it as well too. So on the right side is what a normal looks like. On the left side is what yours looks like.
Oh yeah.
So you can see there is a huge curve that arcs backwards like this. And so when we look at this, well, this number should normally be measured at around 40 degrees. And when we measure yours, you are at a 75 out of 40. meaning that you have way too much of this curve here. Now, how does that impact you? Because when you have all of this curve going backwards, the muscles, the ligaments, the nerves, they are just being compressed. When it's compressed and there's no room and there's no movement, your body hates you. Because
I feel it.
Yeah, and that's the thing, right?
Yeah.
So the biggest thing is that we want to expand this curve and make it more like less than 75, more like 40 degrees is where we're trying to get to, so that the nerves have room. Because right now, in that lower back, if this is the way that it's supposed to be, you can see how much space is in here like this. Now there's also like thick layers in the back. Whenever you pull backwards, it pushes down, and then there's even more of a torque. But you take this and it pushes and it jams hard. And when it's like this, it can't turn the way that it needs to. It can't flex the way that it needs to. And basically the lack of movement. So even just, not even nerve-wise, but as a person. If I were to swaddle you as a grown-up and you weren't able to move for like 8 hours, you would try to move because you felt like you were dying inside.
Yeah.
Right? Same thing. This feels like it's dying inside. So right now, that's why you're having a lot of that pain, is because there's just no movement in there.
Okay.
And what we need to do is open this up like this. And that's why I was asking how the pregnancy was, because a lot of times whenever people are pregnant, their bodies do change in such a crazy way. And it's not until sometimes a little bit later that, oh, you add something else into it, and then it culminates into this catastrophic part in your life right now. Okay. But this is yours. This is a normal. What do you notice about the two? It's straight, yeah. And it's super far forward. Yeah. So number on this one's not that much different in the lower back. This should be at 43 degrees instead of 40. And when we measure yours here, you are at a 14.6, which seems bad.
Yeah.
Right? So I want you to slowly look to the right for me. Is there any pain when you do that?
Right now, just I can feel right here.
In the mid-back.
Yeah, but it's been like that since I sat down.
Okay, so stay right there. So your nose, and that's weird for you to feel that, right? And this, but your nose right here is like 60.
You want me to hold it?
No.
Okay, sorry.
No, you're okay. Your nose is about 60. Ideally, you'd like to be closer to 90 this way.
Okay.
So without having you to force. So your eyes can come, but your nose is still like right there. Look to the left. Pain, tightness, tension there?
No. It's like I said, just the lower,
the mid
point, yeah.
Okay. Nose still at 60 here. We want to be closer here. Headache, migraine today?
Yes, I have right here. It was over here earlier, but now it's here.
In the back. Okay. Does it normally happen on the right side, left side?
Yesterday was on this side.
Okay.
Yeah.
Let's have you look all the way up to the ceiling for me. Is there any pain when you do that?
Just my head, because that's already hurting. But yeah.
And then look down. Any pain there?
Right here.
Okay.
Yeah.
All right. And let's have you try and touch your toes for me.
Oh gosh.
Okay. So that's rough. So when you go down, where do you feel that pain?
Right here.
Okay.
Yeah, all the way up my leg.
Gotcha. Okay. Yeah. Go back down again. Yeah, so this is just so flat, like there's no rounding. There's too much rounding already, so there's no more rounding than it can.
Yeah.
Stand back up, go face down again for me. Keep that left leg straight, and then I want you to lift it up as high as you can for me. Is that painful at all when you do that?
Right here.
Okay.
Yeah.
Go back down, and then do the right side for me too. Is that easier or harder for you?
Easier than the left side.
Easier than left side? Okay, go back down. Ready?
Yeah.
Popping up.
Oh.
Yeah.
Okay. Sorry.
It's okay. Most people don't expect that. I'm gonna push down, okay?
Okay.
Here. Good. Any pain when I do that?
Mm-mm.
All right, good. Yeah, all right. Last one, left leg all the way up. Great. Much higher too.
Oh yeah.
I know you can't see it, but we're not fibbing, I promise you.
Okay.
Lift the right leg up too. Yes. Good. So you can also see that there's more movement back and through here.
Yes, I can.
Whenever you are doing that. See, this one's a little bit easier, right? Mm-hmm. This one is like, no.
Yeah, it's like...
No from immediately holding. Now, I want you to keep holding there. I'm gonna let this kind of open a little bit more. These Disney socks?
They're Lilo.
Lilo and Stitch? Oh my God, man. Associate love stitch.
Oh.
Wow. All right, you okay?
Yeah.
That got a lot of your ankle too, huh?
Mm-hmm. I felt it in my ankle immediately. Yeah.
Like that thing's been stuck in a while.
Feels good.
Move this one, and then move this one. Feels like you're trying to go in a circle, right?
Yeah.
This one
can go in a circle.
You can go in a circle. So let's open this one too. Just like that, yeah. Good. Okay. We can get that a different way. Good. There it is.
Oh, how nice.
Yeah. And then here too. Good. One more. There it is.
So good.
Good. Now, move the ankle around on this one. Yep. And this one. Alright, so we got a little more on that heel, but that's good. Lay on your back for me. How you feeling?
Better? No.
Yeah, good. Not so bad, right?
Not so bad.
So the fact that you were telling me like your calves are one of the biggest things. So when calves are like that, a lot of it comes from the foot. So when the foot is rough and there's no movement in there, you're gonna feel your calf be really rough as well too, because like you can't plant. And from the adjustments we just did on your feet, it doesn't look like you plant very well, right? Because it almost looks like probably you, I don't know.
Well, I stopped wearing heels because my feet hurt so bad.
That's good. It's tough for you.
So I only wear Crocs normally.
Oh, okay.
Yeah.
The Crocs are pretty good.
They're comfortable.
And just like this, we're gonna pull this down right here. Good. Let that come down a little bit. There we go. Any pain?
I can feel it, but it's nice. I don't know.
It's like a pain?
Yeah. I can tell it's doing something.
Here. Move this one around again. Yeah. Better?
Yeah.
Good. Alright, you're right there. You are?
No, that felt good.
Yeah, that was a lot. One more. There it is. Okay. Move the left again.
Oh, left, sorry.
Yeah. And move the right. Good. It's gonna be kind of weird, I'm just letting you know. Because I'm literally like slamming your ankle against this.
Okay.
Okay. So we're just going like this because I'm trying to open this area.
Okay.
Here.
Oh, that does feel weird.
Here you go again. Good. Awesome. Try and move that left again. Yeah. Getting a little better. All right. How are we doing?
Good.
Good. Let's have
Confident now?
you confident?
Yeah.
Yeah. You don't feel so scared?
No.
All right. So I want to have you sit up for me. We're working you a little bit.
I can feel it.
You might be sore tomorrow.
I'm okay. I'm not doing anything tomorrow.
Okay. And what I want to do is open right in through here, okay?
Okay.
So I'm going to take this hand. What's that?
I was just trying to breathe.
Oh.
Breathing.
Underneath here. So you're going to keep this just like that, and I'm going to roll you backwards.
Okay.
Good. Let the shoulder relax a little bit first. A little couple pops. Let the head go back now. Head backwards. Drop the shoulders back with it. Yeah. There we go.
Oh my gosh. Wow. Okay.
Yeah.
Yeah. I've never popped that before.
Mm-mm. That was right in those areas that you were talking about.
Yeah, exactly.
Earlier, yeah.
Mm-hmm.
Good. Let me sit you up again.
I can already tell the difference.
Yeah?
Yeah.
What way?
It's not as sharp pain as coming up.
Oh, so there's normally a pain when you're coming up like that?
Yeah.
A sharp pain, okay.
In that spot.
Mm.
Yeah.
Good. So movement, right? So what happens, I like to explain this to people because I always say like it's not movement, it's not moving, it's stuck. So what does that really mean? So basically each one of these things, we call it a segment. So a segment's between like these two. So they should always move with each other. So the thing is, when your body has been stuck for such a long time, quote unquote stuck, the ligaments and muscles, so say for example, instead of this being individually going like this, think of like a brace that's like this, and it takes it all at once instead. So instead of you bending with these 5, you're only bending with these 2. And that's what's going to cause a lot of that pain, because this is just getting overworked and it's not getting worked that way. So like I said, I think it is the mid-back more than anything. Right. That's why it's so stuck like that, which is fine. We're going to have to open it up a different way here. Let me see this, just like this. All right, and what we want to do is take this and pull down right there. So we're feeling that tension that's right there?
Yes.
Rolling.
Oh, ew, wow. My goodness. Wow. That went from like here up.
All the way up, yeah.
Oh, okay.
You all right?
No, I'm great.
Good. Lay on this side now for me too. We're gonna have you bend this knee here. Good. Okay. Keep this one straight. Let the body breathe a little bit. Yeah. That's it. Okay. Let's roll a little bit. Yes.
Oh my goodness.
Yeah.
That's great. Wow.
That moves so good.
I've never had anybody with a camera in my face.
Yeah, you eventually get used to it. It's not every session, I promise you.
Yeah.
Let's have you sit up now for me. And what I'm doing, so we're shifting this atlas that's right here. And we're really gonna pull it back towards center again. So we're finding that point. Good. Try to let your ear drop a little bit lower, but relax that muscle. There.
Holy.
Wow.
Sorry.
That's okay.
Holy crap. Holy moly.
Yeah, I had to pull off a little bit too because I was actually going to pull harder.
That felt so good.
Good.
Can I take you home?
No.
Oh, that's like how I want to crack my neck.
But it doesn't.
No. Oh my, it like here, like I felt it everywhere, which is crazy.
Yeah.
Wow.
That, when I say it was like far left, right? So when we look at this, I'm going to show you, you see how it says 31 millimeters over here? I know you can't, you might be able to see it, but this side is on the right side. You're at 22, so normally that should be even.
Okay.
So you're so far off, and when we see that, that means that this bone right here has been like this. So it's going to cause headaches on both sides just because it's not straight. It doesn't like it.
Wow.
How we doing?
Great. Yeah. That was so cool.
That was, chalk that up is probably the loudest I've had in a long time.
Wow. That was awesome.
What did you expect it to feel like? Were you scared?
I was, like I said, I'm so excited to not be in pain that I'm like, I'll do anything.
So right here, we're gonna go again right there. You feel this part?
Yes.
All right. I feel that right there as soon as I put my finger right there. All right. Good. All right. Put your hands to your side. That's better. Is your whole family like Disney, Yvonne? Yeah. Lilo and Stitch. Beautiful.
Oh my gosh. Oh my god. I felt it over here too. Oh my goodness. Wow.
But you can feel how different that kind of was than the first one.
Yeah.
Right?
Yeah.
How you doing?
Good. Let's do more.
Let's lay on your back.
Okay.
Let's do one more.
Oh, this is wonderful. Holy crap. Sorry.
What's that?
Just said holy moly.
Oh.
She said holy crap.
I thought I heard the crap in there. Ready?
Oh, I'm ready.
Okay. She went from being scared and nervous to just do it.
Go for it.
In through your nose, out through your nose. Good. Does that hurt at all when I'm pulling?
I can tell it's like tight.
Okay. I'm going to give you a few pulls so that deep breath in through your nose, out through your nose. we're doing this so that we can get some stretch first before we actually pull. Deep breath into your nose, out through your nose, in through your nose again, out through the nose again. Better.
What just the happened? Oh my God. Okay. That was nice. That was really nice. Like I felt it through my entire neck all the way down to here.
Good. That's what we wanted. So.
Oh my gosh.
Yeah. Whenever I was adjusting that mid back, there wasn't any space. The first one was fine. The second one was a little bit tougher. I was like, there's no space in there. Okay. So we needed to pull to get more of that space.
Wow. Yeah. Wow. I can feel it like in every little.
Yeah.
Yeah.
That's kind of nuts. The first time is always, I think, the craziest one. Actually, the second one might be worse. But better.
Yeah.
Better, worse in the sense like there's a lot more. I should never say worse.
Wow.
Do you understand now why I rave about my appointments with him?
Yeah.
Yeah, that's why.
Wow.
How we feeling?
I just like want to lay here in like happiness for a second.
Do it.
Yeah.
We don't try and rush anybody. I want you to take it in.
It feels good. Like it feels like I can feel, like I said, every, like from that point of where, even lower than where that was. So it's like almost to my hips. Yeah.
Yeah.
Wow.
I mean, you've been dealing with this for a long time, right? Even before you were diagnosed.
Yeah.
Your body was already changing.
Right.
And just if you're in that much pain all the time and you've had a headache every day, your body's just not going to ever be functioning well. And then you lose yourself too.
Yep. I know that.
Yeah.
Yeah. Oh my gosh. That was great. Okay, what's next?
Let's have you sit up. Look to the right again. That's 100%. You went from like 60 to 90.
Yeah.
Pain?
No.
Good. Left. How does that feel?
Great.
Awesome. Look straight. Can't go to the side. Let's have you look all the way up to the ceiling. Heck yeah. Any pain?
No.
Look down. That's better. How does that feel?
Good.
Stand up now for me too.
I don't have the pain right here.
That's awesome. But go ahead and try and touch your toes again. That's way better.
Yeah.
How does that feel on you?
Good. Like it's not as painful in my legs either.
Okay, good. So what I want you to is actually start practicing that a little bit more.
Okay.
I also like you to start walking. I'm going to recommend some shoes for you. They are called, any functional movement shoes would be great.
Okay.
A lot of times, like, you have to stop wearing heels, right?
Yeah.
The reason why is because when you're like this, everything is just jamming. So whenever everything's jamming, it hurts.
I only wear heels for special occasions now.
Yeah, that's good.
Yeah.
How do you feel?
My body feels different and I like it. Like it feels like I haven't felt this way in a long time.
Wow.
And I can tell my feet already. Like it's crazy.
You want to walk a little bit?
Sure.
Yeah.
Yeah, it's not as painful right here. I feel like I want to go running. Like that's just how I feel.
Yeah, that's huge.
And I don't like to run because of the pain.
Did you like to run before?
No. But I will.
But now.
But I feel like I can run.
That's
like,
good.
You know, I never I stopped going on hikes because it was too painful. So like I would love to go on a hike. Thank you so much.
Yeah, you're so welcome. I appreciate you. Thank you for bringing her in. Oh.
Wow.